Our guest today is Calley Means, and Calley is the co-founder of TrueMed and co-author of Good Energy with his sister, Dr. Casey Means, where they tell the story of what's happening inside and outside of the medical system that has resulted in the chronic conditions that plague most Americans. His company, TrueMed, is built around the idea that food and lifestyle habits like exercise and sleep is medicine, which can reverse or prevent these chronic conditions, and that we should have affordable access to the people, programs, and tools that can help. Welcome to the show, Calley.
Oh, I'm so pumped to be here.
Well, as we were saying just before, I mean, this conversation has been a long time coming, and we are really honored to have you here. I'm going to say probably a good percentage of our guests know who you are. I mean, they've maybe seen you on Dr. Phil, Tucker Carlson, or many of the other media outlets talking about the dark side of that intersection between big pharma and politics, as well as big food. And we're going to definitely dive into that stuff. But before we do, what I would love to start with is just give everybody an introduction to your company, TrueMed. Like, what is TrueMed doing? How does it work? I think they would be interested to hear about that, especially too that we utilize TrueMed in our business, Pure Physique. So we're really excited to be able to present this to more people.
Yeah, so we'll get into the corruption, as you said, but yeah, I think there's a dark story and a really positive story to health. And the dark story is, I think, a lot of incentives are stacked against us, but the positive story really is these incentives can be changed and Americans want to be healthy. And I think fundamentally what TrueMed started with is, myself, and we'll get into my background, and then my co-founder, who his name's Justin Mares. He's been starting healthy food companies for 10 years, Kettle and Fire Bone Broth, Perfect Keto, and others. And he saw how hard it was to basically start a healthy company, how much was stacked against him. And we asked a simple question, which is that how do we steer medical dollars, these $4.5 trillion we spend on our medical care, how do we steer those to healthy habits? We had a fundamental thesis that what would happen if those $4.5 trillion went to metabolically healthy things? What if we actually trusted the American people and incentivized them to be healthy? One stat we looked at is that Medicaid, which is the healthcare for lower income folks, we spend more on Medicaid on mitochondrial disorders like diabetes than the entire defense budget. It's like we're basically just spending all of this money to treat. What if we actually incentivized wellness? So, okay, great mission, awesome, but where does the rubber hit the road? And what we found is the rubber hits the road with HSA FSA dollars. So this is a program that 80% of Americans have access to. It's actually a great part of healthcare policy. They're flexible dollars and they go to flexible qualified medical expenses. And what we learned is that the IRS is actually clear that medicine is not a pill developed synthetically by one of these big pharma companies. Medicine is what a doctor says to their patient can help prevent or reverse a condition. And what we found is that can be exercised. That if a doctor recommends exercises for the prevention or reversal of a condition, then medical dollars can go to that. All it takes is the medical note. Then we looked at what happened during COVID with all these telehealth companies prescribing drugs. And we talked to the same lawyers, the same people that set up these telehealth drug prescription companies, and we actually realized that you can use that same process to prescribe vitamin D, broccoli, and exercise. So we set up the most seamless way we could possibly do it to intake information from patients and connect them with third-party medical providers, licensed, and if appropriate, recommend them the metabolic healthy things that we believe are at the center of medicine. And through that, in the past just 6 months, we've unlocked over $100 million of tax-free money towards exercise and supplements. It's growing very fast. We've helped over 150,000 Americans. And this is, I think, an example to us. This is a case study of how you can actually empower patients with flexibility, not to lecture them about eating healthy or exercising, but just to give them the choice. If somebody is pre-diabetic, if somebody has high cholesterol, if somebody's battling being overweight or obese, they have a choice. They should know that. That's the point of our companies. Actually say you can actually go on the path of drugs, which in some cases might make sense, or you can actually work with your doctor, work with a medical provider to get a letter of medical necessity for root cause items. And that's the mission of our company. And yeah, just very specifically, we work with amazing companies like yours to make this telehealth service available and enable seamless HSA, FSA tax-free reimbursements.
I just think it's so amazing. And I'll be honest, when Mike presented it to us as a leadership board, I was like, this exists. I mean, it just seems so obvious that we should be able to tap into that. I come from a teaching background, and so I always had money in my HSA, and I was never able to use it on a gym membership. So for people that actually want to be healthy or want to address root cause, I think it's so phenomenal. I just personally, I have to ask business owner to business owner, given your background, which we'll get into, how does it feel? And did you ever think you'd be in this space unlocking $100 million for health and good?
I never expected to be on podcasts evangelizing healthy eating and exercise, to be totally honest. I'm a very unlikely person. I haven't always had the most healthy habits. I don't come from that background. I grew up in Washington, D.C., and I was really passionate about public policy and passionate about American competitiveness, and, got into politics early in my career for, I think, the right reasons. It's all gone full circle, because what I found, I'm actually sitting here, I'm actually meeting with politicians right now, right after this. If you hear sound, I'm at a hotel at a conference, actually. What I found is that the most important issue in the country is what's happening to our health. I mean, it's just that simple. Through, my experience, which I'm sure we'll get into, seeing it early in my career with the food and farm industry, my sister, coming in and out of the system, there's various puzzle pieces I put together that really convinced me, if we don't get our brains right and we don't get children's health right, and we don't understand that, these warning signs of what's happening with obesity, with chronic disease, with infertility, with childhood disease, if we don't get those things right, then we're really not going to be on a great trajectory as a country. And so it's really putting those pieces together. And I think more people are waking up to this. If we don't get health incentives right, we're really not in a good place. So that led me on a path I'm really grateful for, to learn from my sister, to help write this book on metabolic health, to use my, hopefully, startup experience to start this company. And yeah, business owner to business owner, we all know how crazy this entrepreneurial journey is, but it is really damn cool to have a company that works with people that we believe are on the front lines of health. I mean, not to puff you guys up too much, but I think what you guys are doing is frontline medical work. I am absolutely just up in arms, and we all should be, that medical dollars and incentives, aren't going to folks like you who are working to get people healthier. I think more than almost anyone else in the medical system. We need to look at, folks that are, spurring fitness, good supplements, food, other metabolic healthy items. We need to not just rhetorically say that they're doing great things, but actually incentivize them for the healthcare work that they're doing. So it feels really good. I mean, this is, it's just a day-to-day battle, and we're dealing with regulators, we're dealing with, various stakeholders, but it's really gratifying.
I definitely want to ask about, the political side of it in a moment, but what are also some of the other interventions that people can find through TrueMed? I mean, you made mention of supplements, programs like ours, but what might be some of the more surprising things that people don't realize that they could get access to through TrueMed?
So we started the company, some of our first investors, advisors were metabolic health leaders we really respect, from Mark Hyman. We're in touch with Chris Palmer, who's a metabolic psychiatry expert from Harvard, who wrote a book called Brain Energy, Robert Lustig, Sarah Gottfried, friends of my sister, Calley Means. So we've been inspired by a lot of these metabolic health leaders' work. And this is really, the book I wrote with my sister, Good Energy, is really kind of the medical philosophy of our company, through Casey's genius. But, metabolic health has several main pillars. So I think food, we would all agree, is a very important one. So we really work to incentivize food as medicine. Movement and exercise is extremely important. So we vet and reject a lot of folks. We really try to work with the best in class fitness providers like you guys, and fitness is a big one. And then supplementation, we believe, is really important. It's not everything, but our minerals in our soil are depleted through our farming practices. We're getting much less of the core macronutrients and micronutrients that we need. So supplementation is important. But then you get into some interesting things. I've really been surprised by the research on red light therapy. We go through new categories, and we have a clinical review, and there's very serious clinical data. My wife actually started using one of the products that we approved and helped with some of her inflammation. So we've got the leading red light therapy companies. We've got the leading cold plunge companies. There's obviously a lot of research coming out of that. We've got the leading sauna companies. Really anything that we can defend strongly and feel very strongly that spurs metabolic health. And I guess the last big category, that a big pillar of metabolic health is stress management and sleep. So we just brought on 8 Sleep, so you can go on their website and use TrueMed right in the payment flow. It's a product that's changed my life. It modulates your temperature and actually provably helps your sleep. And then various natural stress management tools that we have as well.
It's awesome. I love this so much. So many directions that I want to go here, but I guess the biggest question people are probably wondering is how they get access to this. So you are B2B, right? You're you business to us business. Is there a way for consumers also to access TrueMed individually?
Great question. So yes, you can go to truemed.com and we have a growing directory where you can really plot out your HSA, FSA spend. Justin and I, when we started this company, have had HSAs and FSAs availability throughout our life and never really optimized it. There is $150 billion in these accounts. I'm sure a lot of people listening have some money in it, but everyone's we talk to is a little bit confused. What do I use it for? A lot of money sitting in cash. We're really passionate about evangelizing that, this is for prevention or reversal. And most people in their 20s, 30s, and 40s, we call ourselves healthy. It's not normal to be dealing with anxiety or depression or fatigue or insomnia or infertility, which is really becoming an epidemic. Any of these little bubbling, not life-threatening, but bubbling metabolic disorders is really important to get a handle on or prevent. If you've got a family history or any type of biomarkers, 94% of American people have biomarkers, showing that warning signs for metabolic health. So you really are entitled, and it's important to use your benefits to get a hold of that. And so folks, I just want to say just really clearly, you're safer now to maximize your HSA, FSA accounts. 80% of Americans are going to be able to do that at the end of the year. Then you can go on truemed.com. We're working with our industry leading, and hopefully we'll be in touch with you guys soon. We're plotting Q4 campaigns to educate folks through our amazing merchants. And then what's very cool is in the past year, we've actually developed a relationship with the HSA community itself and the various administrators. So we're actually been working with the HSA administrators who know who's on their platforms that have HSAs to actually educate through the administrators themselves, our marketplace, and the potential ability of people to not just buy drugs, but use their HSA money for root cause interventions.
Beautiful. Just really quickly, I'll tell you what I used to spend my HSA money on. I would either let it expire at the end of the year, like most people did, and my pre-tax dollars would just go away, or I would go on and buy Band-Aids, cold packs. I was like, ooh, blood oxygen. I mean, like it was like dumb stuff, like if I knew. And again, I'm not in that world anymore, but if I knew, and so I really just want to encourage the listener right now, if you have a health savings account or a flexible savings account through your employer, go to TrueMed, that's TRUmed.com, and go and see what you can get access to and use that money that's pre-tax.
TRUE.
Oh,
Now, True
sorry.
TRU, I believe, is a weed dispensary.
It totally is, and I searched it, and I'm so sorry I said that.
No.
So take that in or
TRUE.
take that out.
TRU. No.
TRUEmed.com.
TRU works too. That's
Let's not go there.
different product, but not what we really are here to incentivize. But yeah, and this really is it's tactical, but I think it's a great point. It's just that this is material. I mean, you can max out your HSAs, $8,000 for a family, and that saves your tax rate, which, 30, 40, 50%, whatever your income and state is. But this is material. And I'll tell you, that what really makes this all worthwhile is getting these stories from folks who, are now able to invest in exercise and now able to invest in some core metabolic habits. So yeah, Q4 is the Super Bowl for us. TrueMed we're going to be working with our merchants, and we're going to be just doing massive brand advertising just to educate people to max out their HSAs. That honestly, and I mean this, and we really try to keep this culture. We don't really even care if you use TrueMed. Like we just want people should be demanding elements from their doctors, quite frankly. We think it's a absolute scandal that most doctors aren't writing letters of medical necessity. So if this awareness gets out, TrueMed's going to benefit a lot, and we're really proud to be working with our merchants to evangelize. Use your HSA benefits, and if you're in any way trying to prevent or reverse a chronic condition, 100% you should be entitled to use that on exercise.
I think it's a major step forward if you guys are able to connect directly with the HSA, because that, they act in many ways like the gatekeeper, right? It's like every good business person has that secretary. You got to get through her in order to get to the owner. And it'd be nice to knock down that wall where right now the only way people are finding out about TrueMed are opportunities like this. Either you're on social media, or for, I guess, probably a lot of people who are already listening to podcasts like this, they're like, oh, great, this is just another resource for me to use. And yet who we really need to reach are the people that have no idea or know nothing about this whole world of metabolic health.
Yeah.
I mean, really, it's lost on a lot of people, because even when we just have simple conversations with intelligent people who come to start working with us, and you start introducing these ideas of what they could do to just completely transform their health, they're like, mind blown. And you think these are the people who are seeking this out.
Yeah.
But the people who really need it are those who are not getting this education and don't even know something like this is available to them.
Well, I want to dive into now your background of how you came to be here, your political background. I mean, I think it would be so fascinating, because I'm sure there's people out there that are like, wow, I wish I thought of that, or wow, he's doing what I thought of, but they didn't have the know with.
Know it all?
Thank you. That's what I was looking for.
Anytime.
Which
That's
is
what I'm
really
here
here.
for.
They didn't have the ability or the contacts. You had that background and that education. So can you just walk us through how we got to be here?
Yeah, I mean, I worked on campaigns, as I mentioned, after college, and then when the campaigns were over, worked as a consultant like most people in DC, and inevitably for the two largest spenders in DC, the pharma industry and the food industry. And the way I define it is, and I've pieced this together with hindsight, is it's fundamentally their job, and what those companies are doing are compromising the institutions we trust to advance their business interest. And foundationally, not a conspiracy, but just foundationally, in a vacuum, the food industry, the processed food industry, their interest are to make food cheaper and more addictive. And then the healthcare industry, just as a statement of economic fact, makes more money when Americans are sicker for longer periods of time. Again, let's just look at the dynamics. The farm industry, hospitals, insurance companies, medical schools, they make more money when there's things to treat. If somebody is depressed, it is very profitable for them to be on medications for the rest of their life, on things like antidepressants, which are the most prescribed drug among women. 25% of women are on some kind of antidepressant. Not a judgment of any way, but that is just a factual dynamic where a large portion of the American people are on long-term drugs for mental health dynamics that don't treat anything, that don't treat a root cause, but manage it over a long period of time. Study after study shows that exercise and whole food diet outperforms people that take antidepressants and go to therapy. So not even going to therapy, literally a depressed population, half exercise and eat healthy, and half do the SSRIs and therapy. The side on exercise and food does better. So this, almost every single chronic condition has these type of studies. I mean, obviously obesity and type 2 diabetes and heart disease, they're foodborne illnesses. I mean, these conditions would be literally at zero if we had changes to our food and lifestyle habits. So from a standard of care perspective, it just actually doesn't make much sense actually from top down that we just put people on a pharmaceutical treadmill instead of really steering money towards these healthy items. But that's the incentives. So that's what I really piece together. And the other kind of dynamic, I talk about a lot, is a lot of people ask, well, what are the motivations? This seems kind of evil. It's like, I think the brilliance of these systems is it takes good people and it gives everyone plausible deniability. Nobody's asking why people are getting sick. Everyone's just profiting from people being sick. And, that was a big thing that I saw working for these industries. It's really frowned upon and out of their purview to be responsible for why people are getting sick. It's really just profiting from those dynamics.
I was going to ask if it really is as nefarious as it sounds. And, yeah, nodding your head, yes, it definitely is. So could you give, our listeners an example of how you saw this taking place? I mean, again, you said you were consulting, and there's that intersection, of course, between politics and big pharma, big food. You have all this money tied to it. So give us an example of what you've seen.
Yeah. Yeah, you were saying nefarious, it's really tough because I didn't even realize how bad it was when I was in there. I think people are realizing it. Doctors have the highest burnout rate and suicide rate of any profession in the country. I think people are realizing that the systems kind of are producing suboptimal results, but people can still kind of justify things. But here's an example. I was working for the American Beverage Association, the interest group for Coke and Pepsi and other soda companies, and I was shocked. We steer donations to the American Diabetes Association. So this was very calculated, but Coke was able to pay, and the American Diabetes accepted money from the chief culprit of type 2 diabetes. I mean, there's nothing, if we were to pin one thing down for the explosion and why now, 1/3 of young adults have prediabetes, which was just unthinkable a generation ago, it's because of liquid sugar. It just goes straight to the bloodstream. And in one 20-ounce bottle of Coke, that's as much sugar as a child drinking it or ingested an entire year 100 years ago, added sugar. I mean, this is just monumental what's happened with added sugar, and then particularly liquid sugar. So not only is the American Diabetes Association not speaking out about that, they're actually taking money from Coca-Cola. I was shocked by that. And it shows this devil's bargain, I call it, where it's really convenient for the food companies to get the stamp of the American Diabetes Association, the American Academy of Pediatrics. It makes it that just implicitly the incentives aren't for those organizations to call out food as the culprit of the metabolic health disaster. And then, I would call it evil. Insane that these companies that are supposed to be protecting metabolically unhealthy kids and diabetes, these industry groups like the American Academy of Pediatrics, these aren't jokes. These groups set the standard of care for, treating kids or treating diabetes. The fact that they don't have the moral clarity to say no to processed food donations, it just tells you all you need to know. There is this, dynamic where it is really profitable for people to be eating ultra processed food and getting sick. It's not only this tacit acknowledgement among the industry, they're actually paying each other. The majority of pediatric wards in the country right now have a Coke machine full of sugar. Working for Coke, that was a priority. It's actually a strategic priority of Coke to have soda machines in pediatric wards in schools to normalize this sugar. To me, that's like having, cocaine machines in rehab clinics. I mean, you go to a pediatric ward, I'm shocked. In most cities, I'm in Milwaukee right now. I live in Phoenix. You drive around any city, the biggest building's a children's hospital with a brand new children's cardiology center and endocrinology center. It's these beautiful buildings. Why are there so many new children's hospitals? That's not a good thing. And they all have soda machines in them. It's because kids are getting metabolically unhealthy. So that's the strategy. It's to really actually normalize processed food.
You see that also, you mentioned the children's wards, but also cancer clinics. Like I never seen, I mean, every brand new building is some form of oncology, department.
Well, and gorgeous. They're absolutely gorgeous, state of the art. You want to be in there, but you don't.
No.
So there was a recent New York Times headline, I think it was, that said childhood cancer rates are exploding and nobody knows why. In 2024, this year, is the highest rate in history for childhood cancer, childhood diabetes, childhood heart disease, childhood suicide, childhood depression, autoimmune conditions among kids, autism. You literally take any chronic condition, it's at an all-time high this year. We know why it's happening. And that's a huge kind of push I'm making now, is that working for these companies, the goal was complexity. The goal was to fund a bunch of nutrition research to make people confused about what's happening and what the culprit is. The goal is to further and further and further silo how we treat disease, lobbying for more diagnosis codes, to have, tens of thousands of different drugs for various diagnoses. My sister graduating from med school chose one of 42 medical specialties. We silo the body. The doctors devote their lives to one small part of the body when their own, pharmaceutical treatments and procedures. 9 out of 10 killers of Americans are tied to preventable, lifestyle issues, period. I mean, it's all connected. And there's a real war to overcomplicate and basically make that almost pseudoscience to say that chronic disease is connected. That it's a huge strategic effort.
I mean, it's hard, isn't it? Because, as a doctor, you spend all this time, money, and energy to put yourself through schooling. And like you said, then you're siloed into a particular form of medicine. And so it's hard to break that mentality that anything could be other than this disease needs to be treated with this medication and that's it, or this type of surgery. And I guess where what I really want to ask you is are you optimistic about the direction that we're going right now, or do you feel like this is really a tough battle that I don't know we can win? I mean, you said you're in Milwaukee, you're going to be speaking with politicians. So which is it? Should we be optimistic, or because of all this money and all the corruption that's taking place, I mean, are we too far gone?
Yeah, this is a great question. So I think we have with this dynamic, and we have to acknowledge this is an existential issue. As 50% of young adults are overweight or obese, 25% of young adults have fatty liver disease, 33% of young adults have prediabetes, and the situation is getting worse. And health spending is outpacing any other industry and going to be 40% of GDP in about 10 years. This is an existential dynamic. So we should be worried. To answer your question, I'm very optimistic. I think one of the great parts of our country, quite frankly, and our system is that we have podcasts like this. We're writing books about it. Everyone's talking about it. And that's one of the good parts about our system. I think we've lost our way on chronic disease. Obviously, we've made many medical advancements in the past 100 years. The system's lost its way, but I think it can get back on track. But a lot of it is bottoms up. And what gives me hope is the bottoms up. What gives me hope is that Americans want their kids to be healthy and want themselves to be healthy. They're spending more and more on fitness. They're working to buy biosensors. They're buying books and consuming podcasts on these issues. I see actually Americans clamoring to be healthier and the system letting them down. And what actually gives me hope is that this bottoms up revolution, it's not people wanting to be sick and lazy. It's incentives. So I think what's happening with people waking up, talking about it from Joe Rogan on down, it's just really about metabolic health, all the podcasts, talking about kind of waking up. It's both sides of the political aisle. So I see that impacting the political debate. What's resonant about people being angry, quite frankly, about the fact that kids are getting so sick is politically resonant. And when something's politically resonant and voters are angry, that wakes politicians up. As I said, I'm in Milwaukee at the Republican convention, talking with RFK here, and everyone's here. I'm working a lot with Democrats too. This is a bipartisan issue that a lot of people are tapping into, that that people are getting so sick, that our systems are clearly kind of corrupt. And I think that creates a moment where when it becomes politically interesting to take this on, that's when change happens. I can tell you from meeting with a bunch of politicians, getting into nuances of healthcare policy, nutrition policy, isn't that interesting to them. Like that's too in the weeds. The key point I'm trying to make is that it's really important and resonates with voters to talk about children's health, to talk about this devil's bargain where kids are getting poisoned and then drugged for profit. That's really animating people. And then if people can continue to get animated on that point, then we can drive better policies. I mean, I think we're on the verge of universal HSAs, 5xing the amount of availability for HSAs, increasing the caps on HSAs, working together to better educate people as more of the healthcare system goes to flexible accounts, not just top down steering people into drugs, but flexible accounts. As people are giving flexibility, they're going to make the right decisions. They're going to go more towards exercise. A mom, whose kids are struggling, if she's given flexibility, I think is going to make the right decisions. So that's what I'm working really hard to do, or as hard as I can, is translate the populist kind of anger and this bottoms up revolution happening of frustration with their healthcare systems to policy change. And I am optimistic that's going to happen.
I love that so much. As you're speaking, I'm thinking about my experience in the education system. I worked at a very well-to-do district. In fact, it's the same town where the Clintons live. And then I worked in a residential facility where the kids literally lived there. And as you're speaking, I'm picturing the kids in the well-to-do town were eating candy, and the kids that had literally little to nothing were eating candy. So what would you say then? I know you talked about policy change and conveying this information. What do you think, in your opinion, is the most impactful way that we can start accessing or giving access to this information to all populations?
Yeah. So it's first off, it is, bottoms up too. And I just think any school administrator or parent, regularly kind of giving kids added sugar. I go to a daycare, for my 2.5-year-old, and the kids are hopped up in sugar. They're giving out sugar. We're moving daycares, but that's almost everywhere. Those adults are poisoning their children, and I think it's criminal, even though it's normalized. We should just speak plainly, like that shouldn't happen, and we're committing really grave harm to our kids. So I think we're like almost like nervous about using English to explain what's happening, but like pounding kids and even babies with added sugars is really damaging to those babies. So I just want to say that I think we need to get more just direct, but the top down has to change. And the two policies to go more towards your question, I'd push on and am pushing on is we need to stop recommending poisonous things, and then we need to stop incentivizing it. I think, to some degree, I've definitely just pushed on personal responsibility and parents taking some action. But parents also, should be able to trust our medical authorities. And when parents are at their 3-year-old's birthday party, giving all the kids sugar, they're actually following government guidelines. And the USDA actually says that it's fine. And even, part of the recommendations to give a 2-year-old 10% of their diet is added sugar. So when you have the guidelines themselves, saying 10% added sugar, which is kind of a joke because it's an addictive drug. So, giving a 2-year-old, it's like saying 10% of their diet could be cigarettes or cocaine. It's like doesn't even make sense, because once you start eating it, it's very addictive. But that's the guidelines. And the guidelines, the USDA just recently came out that a child's diet, 91% ultra processed food, which almost inevitably means it has processed grains, which turn into sugar itself, seed oils. They say 91% ultra processed food diet is safe for a kid and actually healthy. So that's where you get into like what I saw, which was there's a huge effort of food companies to pay for nutrition research, which is then used to advocate for, and basically prop to the government regulators who are also paid for by the food companies to say that sugar and ultra processed food is healthy, which is still happening today. So I just think literally tomorrow, if you just got the corruption out of nutrition guidelines and had the USDA say to parents, we're not banning sugar, but we strongly don't recommend it for kids, and there's a metabolic health crisis, parents are followers. Like that would change behavior immediately. Like if the USDA didn't make policy, but just said we recommend against sugar for infants or babies, or toddlers, then that would change things overnight. Schools would be more compelled not to feed their kids toxic food. So I think that's a big problem. And then if you add up all the incentives through school lunch programs, which have no sugar limits, or SNAP food stamps, or other agriculture subsidies, we also subsidize ultra processed food hundreds of billions of dollars a year. So that's where I would start is get and I'm frankly talking to leaders about, it's like, if you want to do one thing overnight, just get the corruption out of the USDA nutrition guidelines, and then policymakers and parents and school administrators can make their decision once the leaders in this country, the medical leaders, say that kids shouldn't eat sugar. It is really would be shocking to most Americans how much of a battle it is to get medical leaders to recommend against pounding added sugar for kids.
You're right, because you have parents who say, well, my doctor says, and then the doctor's saying, well, I took this from, the RDA, this is like USDA's recommendations. And then you have, universities like Tufts creating like food index where Fruit Loops are healthier than a steak. And no wonder there's so much confusion, number one, but there's so many layers to pull back. And I think that probably for me, I think until people do get angry, you're not going to see change. And we were actually having this conversation just a day ago with one of our people on our leadership team. And we were saying how, when you think about what happened with smoking, right? Doctors smoked in the office while they were treating you or seeing you. And then finally it takes decades, it seems sometimes, for people for the light bulb to really go off and then say, yeah, maybe that wasn't a great idea. And then it becomes acceptable. And that's why I was asking before about your optimism, because, I just see what happens in politics, especially as well. Only when the public reaches a certain degree of anger do politicians then say, I could run off the back of this. Smoking's no
Right.
good. I could get on board with that.
To be blunt, that's my strategy is going into a congressional office and giving them a nutrition study. It just doesn't resonate with vote. They don't see that as a politically salient topic, but tying the frustration. And we see, whatever you think of him, RFK has tapped into a real block of voters who foundationally are upset about, I think, children's health and public health. Whatever you think of him, the foundation, I
Love
think.
him personally. Just gonna
Okay,
say,
good,
absolutely love
good.
him. I
He's
subscribe to
amazing.
Children's
Yeah,
Health Defense, and everyone should too.
there you go. I mean, I think, they try to tear him down, but if you listen to what he says, it's kind of hard to disagree with a lot of what he says. He's an incredible
Logic.
messenger on this issue. And then this might be getting a little more controversial and no value statements either way, but like, the foundational premise, I would argue, of Trump's candidacy is distrust in institutions. And I think you have this around the world where you have populist figures rising up on the left and the right, really with the basis of like, our institutions have let us down. So I think that's the defining actually political dynamic, and really historical dynamic of the past decade is this rise of populism and distrust of institutions. That can be destabilizing and a negative thing, but I actually think there is a positive element to it because our institutions have let us down. The largest institution is our healthcare system. It's the largest and fastest growing industry in the country. So I think it's all about how you channel it. It is out of the bag. Voters, Americans, people across the developed world are frustrated. So then it's like, what do you do? And if we can channel into more of a metabolic view of health, that is a positive development. And, our book that I wrote with my sister is called Good Energy. It really is a positive book. It's about bottoms up empowerment and how this really can go in the right direction. So I think we need to embrace this distrust of institutions as a potentially good thing, really make our voices heard to show that that's a politically resonant issue. And then I'm working really hard from the top down as that political terrain becomes more accepted, have the right policies that are ready to sign.
Love that.
Well, I'll get political for a moment.
Oh boy.
Yeah. I mean, I was saying that, like, to me, my pipe dream was, all right, Trump becomes our next president, and then RFK becomes our Surgeon General. And I was like, that would be
change. Well,
ideal.
it would just change so much because these are not people, these two individuals particularly, and others that need to have their palm greased by some company. These are people that are already successful. And so they are less likely to take a bribe. So think of them what you will for whatever reason. But when you begin to think about the actions that they take and the words that they speak, it is for the people. It's for the people. It's not for them,
Well, they're not afraid to speak their truth.
Yeah.
And I think that's
It's not their
important.
truth though, it's the truth.
Their truth.
Well, Mike, I'm in Milwaukee. I share your desire and we'll see what happens this week.
That'd be amazing. So let's actually just take a slight detour. We're talking about the book. So what are the recommendations? I mean, we know what not to do, right? We need to cut out the sugar and do our best to avoid those ultra processed foods. I mean, maybe what do you do personally, or what is it that you recommend to others?
Yes, the first half of the book outlines the science and the science of metabolic health, and really Casey unpacking from the 42 subspecialties to understanding that disease is connected, and really through her genius really outlines the science of how truly like almost everything that's ailing us is connected by metabolic health. And it outlines the incentives that we've been talking about as, my area of expertise. The second half of the book goes through extremely tactical tips. And it's been surprising. That's really been what's resonating to folks. I mean, it is interesting. Even the most educated people far along in the journey are still lost at a grocery store. And we go through tactical lists. We go through frameworks of how to build your meal, getting that protein, getting the omega-3s in, getting some fermented foods in for your microbiome, going through the different categories you want to look to for fiber, and then what to avoid, the omega-6s, which are, the seed oils, the grains, the added sugar. So really going through a tactical principles and shopping lists, and then going through the other pillars of metabolic health, sleep, movement. We call it circadian rhythm, just understanding how the fact that we're ingrained with this clock that's really dysregulated in the past 100 years with the invention of natural light and travel. I mean, we didn't used to do that. Our body is just evolutionarily made to be on a rhythm with the sun. When the sun went down for almost all of human history, we were going to sleep. There wasn't much light. And actually that disruption to our circadian rhythm, and there's more coming out about this. I used to think it was kind of this frontier area that, was kind of fringe. It's not, so we go deep into that. But the core principles in the book is that we are systematically led to believe it's more complicated than it is. We talk about how there's all these debates and all these books about what the proper exercise technique is. And I'm sure you guys have many opinions on that. And I think it is important to optimize. But there's not an epidemic of metabolically unhealthy people that are doing 180 minutes a week of exercise routinely, right? It's like, get started is our point. And then we have frameworks on how to optimize. But I don't think there's anyone that's committed to the regular exercise that isn't then optimizing from there. I don't think there's anyone that's committed to 80 to 90% of their diet being non-ultra processed food, and then on a bad track, whether they're vegan or carnivore. My sister started as a vegan and now, is against that. You evolve as you have the high level principles. And our point is there's a lot of distraction from people even getting started. Cut the ultra processed food out, move for 180 minutes a week, work on a regular sleep program in the 8 hours. We go through tactical tips. We go through tactical shopping lists. We go through tactical protocols for these basics of metabolic health. And the book really unapologetically argues that it's simple. But again, a big part of it is going through 40 specific areas of metabolic health with a really, really tactical framework.
That so much. And what I'll say to, again, just really edify that is I would say at least half of the people that reach out to our company, they're confused. And hearing from you, I mean, I've never heard that until today, that the complexity is calculated. It's a calculated complexity to confuse the consumer into not taking action, because if you don't know what to do, they just don't do anything.
Well, also adding to that, you consider you have somebody like, Cheerios, paying the American Heart Association
Lower your
able to
cholesterol.
put on their box that, yeah, this is a heart healthy food, and yet it falls right into the category that you just mentioned, Callie, of being grains.
Yeah.
Right? I mean, what is going to disrupt your metabolic health more than that? I mean, table sugar, of course, but the point being that you're getting a recommendation from an institution that you trust
Yeah.
that this particular food is not only okay for you, it's actually healthy for you.
Well, I guess my next question to you is, total pipe dream. You have a 2.5-year-old. Do you have other children or no?
Just the one.
Okay, love that. So 2.5-year-old, for you in your work, of course, we're all here to leave a legacy. And so what would be the most incredible legacy that you could leave for your 2.5-year-old when they become an adult?
So I have a really simple framework that is my life's work, which is to steer more of the $4.5 trillion from sick care to metabolic health. I think what I'm passionate about is that I've found, this passion, I'm channeling it into one metric, which is that I think that the American people will make the right decision if we have the right incentives. The childhood obesity rate in Japan is 3%. Here, 50% of young adults who are overweight are obese. There's a unique problem happening in America, and fundamentally, I want to change the paradigm of medicine to reverse that, to have 90% of our medical costs go to basically incentivizing people to be healthy. It sounds so simple, but that's not what we do. My mom, a huge impact on me, abruptly died of pancreatic cancer after 40 years of metabolic warning signs. We spend 50 times more on cures for cancer rather than researching how to prevent cancer. Cancer is a preventable condition. It's skyrocketing because of reversible factors, and we spend no amount of money. We just accept that as a given. And so I want to reverse that. And I would feel it's a victory professionally if there were trillions of dollars instead spent on, regenerative agriculture as part of health policy, and incentivizing, instead of just paying for drugs for the rest of a lower income person's life, once they at 15 have, high blood sugar, like actually like incentivizing exercise and better habits and better curiosity, and better eating for them. So that's my goal. And then, on a personal level, it's really rewarding to be on this path, because, writing this book, I thought a lot about my child. And, I think one of the best things we can do individually is just be on a path of curiosity. To me, metabolic health is really a spiritual thing too. I mean, just being more connected to our soil and what we're putting in our body, and the whole cycle of things, and the interconnectivity of what's happening inside our body is really important. That's being taken away from us. So I think it is a really important thing for my life journey, and hopefully to impart to my child, of like, just like awe and curiosity about the interconnectivity of our body. I mean, I just think that's being taken away from us.
We're sorry to hear about your mother. Is that where this passion stems from, though? Was your experience of what she went through, was that
The
part of
driver.
what drove you to do this? Because, as we said earlier, and as you began, this is not what you set out to do, yet this is where you find yourself today.
Yeah, it all came with my mom's death. So in 2021, or January, she thought she was perfectly healthy, had a pain in her stomach, went in to get a scan. She got a text saying it was stage 4 pancreatic cancer. And she called me and said, she was going to die very soon, and not going to be able to meet her future grandchild. So the big moment for me was sitting with her and Casey, my sister, who graduated from Stanford Med School, across the table from the top oncologist at Stanford Med School, who looked at my mom and said this was unlucky, that this was a tough break, the pancreatic cancer. But my mom was on 5 medications going back 40 years. She was on the statin, she was on the metformin, she was on the ACE inhibitor for high blood pressure. And each time those were prescribed and she had the biomarker, she was told this was normal. It's a pre-diabetes, pre-disease. 50% of people your age have that, no problem. Here's the metformin. Instead of the doctor explaining how those biomarkers represented underlying metabolic dysfunction that would have inevitably eventually give her something more serious. So it wasn't unlucky. And the doctor, the lead oncologist, one of the top oncologists in the world at Stanford, didn't even understand that, because they weren't trained that way, because 90% of doctors graduate without one nutrition class. So as literally as we buried my mom, my sister and I, vowed to make this our life's work. And we started the book that week, Good Energy. I had passed off my other company, and I really helped put together the experience from working in food and pharma, and my sister's experience being a, top of her class Stanford Med School surgeon, leaving the system after coming up with this awakening on metabolic health, starting a company called Levels Health, my sister, which is a continuous glucose monitor, helps people understand their blood sugar. So yeah, I spent 2 years helping her write this book, and through that came up with TrueMed, and through that started sharing my experiences, and Tucker Carlson and other folks reached out and started advocating, and it's all kind of interconnected. And I'm just really grateful. As a small data point, the book, which I really poured my heart into with my sister from my mom's death, it's, it debuted at #1, and it's still, 10 weeks out is #3 on the New York Times. It's, I don't say that to brag, or I just like, it's kind of overwhelming. Like I really think that people want to be healthy, and it's a small data point that's really visceral for us. I was not expecting it. I mean, people are really like, a contact recently just said he bought 50 books for his company. It was exactly why we wrote the book, which is just to provide a little bit of a framework and tips, frankly, tips that we've learned from metabolic health warriors like Mark Hyman and many others, and it's just trying to share that vision. I think people are clamoring for answers. So that's our framework. And my sister and I just really see ourselves, as grateful to be kind of battling this as much as we can.
I mean, it's a perfect example, though, of a family who got angry at the system, and what can happen
I just got chills when you said that.
when we take that anger and direct it in a positive way, which is what you guys have done. I mean, you didn't just go out screaming and yelling at the oncologist and everybody else. It was literally like, we're going to go do something about this. Began with a book. Now we have TrueMed. And I mean,
Levels.
it's just, yeah, Levels. That was just YouTube at first. And then you get all these people who start coming on board, and this thing starts to grow. And I think in this moment is actually when I, for the first time, am feeling very optimistic about the direction that we could go and steering this ship in a different direction, because that's really what it takes is people getting angry, but not just screaming and yelling at the top of their lungs and getting on social media.
Yeah.
It really is about like, take action.
Well, let's make
Go
your
do
pain
something.
pay. You wanna make your pain pay, and there are so many people in America that are in pain mentally, physically, and emotionally. Listen, I worked in that residential facility, and my doctor was like, "Xanax, here you go." Literally, I was on it for a week. My teaching assistant's like, "Do you have a personality anymore?" I mean, it was such a wake-up call to me, and thank God, honestly, meeting Mike, getting off sugar, my narcolepsy went away, my IBS went away, my skin cleared up. I'm like, "What?" I spent months and years, like, I was in a lot of physical pain at 24 years old, and so I just look at these children today, 6, 7 years old, obese, 2 and 3 times the size they should ever be. It's painful.
Yeah. Yeah.
I appreciate those comments, guys. I resonate so strongly. And on this path, I was, pretty despondent. I mean, the first manuscript for the book was called A Sick System. It was really just a negative diatribe. I mean, I was very despondent. I mean, it breaks my heart looking at what's happening to kids. I mean, it's hard to even wrap your head around. But it's interesting. It evolved into good energy because, as we talked about, I think we've lost our way a bit, but there is real hope. And I think it's all part of the journey. I mean, I think so many people are waking up, and I think their wellness journey is one of the defining parts of their lives. I mean, it's an important. I mean, my mom, inspired by my sister, was on an amazing journey, and she had 100 books in her house on blood sugar and metabolic health, and she was too late for her, but but I feel like she lives within us. I mean, just being on a journey is really important. So yeah, if personally, it is really catalyzed the mission for us, and it is really hopeful to be pushing on this mission and meeting so many people in the space. And I just have to be optimistic.
Yeah.
Well, as we close this out, we just want to thank you for the work that you've been doing, you and your sister and partner. I think it's amazing. And we just hope that this message continues to resonate with a lot more of the people who are listening to this, as well as
Yeah.
other podcasts, shows. I mean, it is just vitally important to get this information out, because that's the first step. And for a lot of people, I mean, they may be the only one right now in their family
Mm.
who is on this journey. And yet we want to encourage you that it's important to stay this journey and to not give up, to continue to work on those around you. And you don't have to do it in a way that is, pushy or anything like that. You just have to, again, be the example, number one.
Mm.
And then people will tend to follow when they see that you're making real change and that your heart is really for them.
Well, I think we're in a generation now where people are the one, and I think about a recent Ed Milet talk that we were sitting in the front row of, just bawling my eyes out, and he's like, a lot of us are the one, like you, Callie, and your sister, you're the ones. You're the ones in your family that broke chains and changed generational direction. Like, we are the ones. And so, yeah, I just want to echo what Mike said. We really appreciate what you're doing. We're going to keep you guys covered in prayer because I'm sure it's not very popular what you're doing in the political space, but gosh, it is so needed today. And just thank you for being the one.
Oh, well, thank you, guys. It's just a real privilege to be on this journey with you.
Thank you so much. Well, everybody, we're going to leave all of the links, as you know, in the show notes so that you guys can find out more about TrueMed, so that you can also pick up Calley and Casey's book. And we appreciate you guys being here with us today.
Thanks, guys.